But of course, if it comes out, then you should deal with the fibroid before the person gets the next pregnancy.
Thank you so much.
Yes.
Doctor, before you get back to your seat,
yes.
How big does a fibroid grow?
Oh my God, sometimes, we used to make jokes in medical school that, one of the treatments for fibroids is to remove the fibroids from the uterus. Now, we used to make jokes that in some surgeries, you are removing the patient from the fibroid instead of removing the fibroid from the patient, which means that the fibroid is so huge, so huge that actually you are detaching the patient from the fibroid. So they can grow as large as you can imagine. Very huge.
Really?
Yes.
Thank you so much, Doctor, for all those illustrations. In case you've just joined us, it's Medical Mind. We are looking at fibroids and infertility. So Doctor was trying to illustrate and tell us where the fibroid attaches itself in the womb and how it can lead to a miscarriage in most mothers expecting. Are there some possible ways of preventing these fibroids from taking place or from the mother or getting it or some?
Yeah, so the thing with fibroid is, fibroid first of all is a very old disease. All diseases are old, but in terms of discovery, we knew about fibroids long ago. If you read even history of medical history books, fibroids, some descriptions of fibroids were long ago, even Hippocrates, I think, saw them. But I don't know for what reason we didn't have much interest in fibroid science. And so it has been a lingering disease for long, and there are many things we don't know still about fibroids. You'll be shocked. For example, we do not know the exact cause of fibroids. And so if you don't know the cause of something, then you cannot be confident about saying that I can prevent it. But we know some risk factors.
Okay.
For example, now we know that there are certain hormones. If you allow a situation where your hormones remain high, estrogen and progesterone, for a long period of time, then fibroids can increase. Another thing is the weight management. Yeah, so if your weight is too much, your hormones are likely to be high. You will expose your uterus to a high level of estrogen and progesterone, and so your risk of getting fibroids increases. So if you can manage your weight, you could prevent fibroids. Okay. If you eat well, you could prevent fibroids. Yes, and which is a little bit difficult to do is people who get pregnancies have reduced chance of getting fibroids. But then we can't advise people to be getting kids just to prevent fibroids.
Let's talk about that, Doctor, before you go away. I have a friend. She's a teacher. She took long to give birth. Her last child was, I think, 9 years.
Yes.
Then she started having cramps, stomach pains, all that. When she went to the hospital, the doctor told her, you know what, teacher, you are developing fibroids.
Yes.
The only way for you to prevent it is to start giving birth again. Because she gave birth at an early age. Yeah. And trust me, when she went back and gave birth, the first child, the second child, she became okay. So you're confirming it that giving birth is one way of keeping the uterus healthy from getting fibroids?
Yes, but of course you have to weigh the options. You have to weigh. If you're going to get 10 kids because you want to prevent fibroids, and of course fibroids are not in everybody, and not all cases of fibroids are significant, then you're not doing yourself a good service. And besides, fibroids have treatment. Okay. They can be removed. So I think the advice, it's an epidemiological observation that people who give birth have less risk of getting fibroids. It's an epidemiological observation, which is not very, very applicable in clinical situations. Yeah? Okay. Yeah. Okay. So I don't want to advise people to go get many babies so that they prevent fibroids. They're trying to fight fibroids. The risk of looking after many number of babies also is much more than
Okay. Thank you so much. Thank you so much for still keeping with us. It's still Bethany TV, and we are looking at fibroids. Dr. Anderbert is in the studio. In case you want to be part of the show in the next coming minutes, you can prepare the numbers 0786 050 762 for you who has just joined us today. This program normally takes place every Sunday from 8 to 9 p.m. So please be a part of the show, and especially the mothers. We talk a lot about our body. We know our body, and Dr. Anderbert illustrates it to you practically and you get to know exactly how to handle certain medical conditions that you could be going through. So those are our numbers, those are our lines. Please prepare all your questions, and you can WhatsApp us, and we get the questions right away. Doctor gives you a clear answer. Doctor, let's look at the common signs and symptoms of fibroids.
Yes.
Yes. How do you know that I have fibroids? Yes.
Yes, and thank you very much, Teacher Zita. That's a very good question, and it is a good starting point. How do I know I have fibroids? In the cases which present with symptoms, there are certain symptoms. But I have to tell you that about 60% of the fibroids have no symptoms at all. That is 6 out of 10 of the fibroids you don't get to know by symptoms. Many of them are discovered. But those which present with symptoms usually present with heavy periods.
Heavy period is the first indicator.
Yes.
Abnormal
periods. So more commonly it's heavy periods. So the periods are heavier per day and they last for more days.
The normal one should at least be 4 to 7 days.
A normal period should be between 2 to 5 days.
2 to 5.
2 to 5 days, average of 3 days.
Okay.
Yeah, but if for fibroids you find the period is for more than 7 days. Yeah, so you have very few days when you're not bleeding, and so the woman can easily go into a state of anemia. You can have low state of blood.
Okay.
Yes. Another common is the feeling of a mass in the abdomen. So you either feel the mass or you see that your belly is growing. Yeah, so if it is a mass feeling, you feel, and you can actually feel a hard mass inside.
Does it come and go, or it's always there?
Well, fibroids, when they are there, unless if they are removed, they always keep growing in size.
I mean the weight, the mass, that weight that you feel like there's something in me, really.
Now, most of them you will be feeling the mass there, it is there, and it will be increasing over time.
Okay.
Some few of them keep, depending on their location, some of them keep on shifting from one part of the belly to another, and then sometimes you get a relief.
Okay.
Yeah, those are not very, very common, but you feel a mass. So you feel the mass, or sometimes that mass can make you have frequent urination. So you can't finish urine and feel comfortable. You find after a few minutes you have to go back, and so that's the challenge. Sometimes the effect of the mass is on the stool, so it obstructs because the womb is just in front of the rectum. Yes, where stool is stored before it is expelled. So the mass will be pressing on the stool, and sometimes it can obstruct, or you can be feeling stool passing frequently. And as we had said, some of them, they present with miscarriages. Recurrent miscarriages, and when you go and evaluate, it is fibroids. Those are usually fibroids which are hanging inside the uterus. Yes.
Thank you so much.
But again, there are others which have no symptoms. So absence of symptoms does not mean there are no fibroids. Yes.
Thank you. Before we look at the effects of fibroids, let's first look at the age group, the age gap that is so eligible to getting.
So we now know that fibroid is a hormone-dependent condition.
Okay.
Fibroids are sensitive to estrogen and progesterone. So we see fibroids actively more commonly in the reproductive age, about 25 to 45.
Okay.
And the peak is around 30 to 40 years. So those are the people commonly with fibroids.
Okay.
Yeah.
Thank you so much. So in case you're watching and you're following, be very mindful of your body weight. Eat very good meals and a balanced diet. Do exercises and tone yourself. I think I'm also in that age, that weight I need to work around to make sure at least my weight is very normal for that. And doctor is advising us, especially ladies, to look out for the signs. Don't ignore some of those signs. You might think you have heavy periods and it's normal because your mother or someone in the family used to have it. Of late, it's a little different, so you need to watch out and follow up immediately. You could be developing it. Doctor, we go back to the effects of fibroids to a woman.
Yeah.
Yes.
So the commonest concern for fibroids is in our population is its relationship with fertility.
Okay.
Now, we do know that some fibroids do impair somebody's ability to carry a pregnancy to term. They can cause miscarriages. Very, very few cases do prevent pregnancy completely.
Okay.
Especially those which are very, very big, they could prevent pregnancy. Yes. But most cases it is the miscarriage